Speaking at the opening of Parliament on Thursday, President Cyril Ramaphosa said that while there is much contestation around the NHI, there is a broad agreement that there is a need to draw on resources and capabilities of both public and private to meet healthcare needs for all South Africans equally. Ramaphosa believes that by implementing this, the government is confident it will bring stakeholders together to resolve our differences. However, the Rural Health Advocacy Project stresses that critical issues need to be addressed to achieve universal health care and that rural health should be prioritized. Director at Rural Health Advocacy Project, Russel Rensburg, joins us now for more. Russel, thank you so much for your time and for joining us this morning. Now, as a representative of the Rural Health Project, how do you define a holistic approach to building a stronger healthcare system, especially in the rural areas?
I think health at the end, health is not just about health care. You know, health is really about not necessarily the absence of disease, but it's really about having good health across all life stages. And I think a health system that's responsive to the needs of the broader population considers those needs. At the moment, our system is very care and hospice-centric orientated, and many health outcomes probably are better affected by early interventions like investments in primary health care, health literacy, and more responsive services to those that the people need. For example, you know, the leading cause of death in many districts, particularly in the rural districts of young men, is interpersonal violence, right? And those are societal issues that we need to look and see how we can better support those communities to deal with the trauma. We also have diseases like tuberculosis that's over 1,000 years old, but still continues to be the leading cause of death in South Africa. And while we do have the science and the medicine to fix that, I think one of the main reasons that we are not evolving as quickly as what we should is we don't fully consider the social determinants of health or the conditions in which people live. And I think we need a multiple approach in order to address the health inequities in our country.
Do you believe that with the introduction of the NHI, we'll slowly find our way in bridging all these gaps that you've mentioned now?
I think the NHI legislation or act really does present an opportunity for us to be a little bit more focused in the way we address health inequities across the system. So I think a lot of conversations and debate around the NHI has to deal with the private sector and the role of the private sector in the future health system. But I think the core of the act really just looks at reorganizing South Africa's publicly funded health system in a manner that's more responsive to the communities that it seeks to serve. As the Rural Health Advocacy Project, we're particularly excited about the focus on district-level health, you know, the investment in understanding health information and health and well-being at that level, and creating an opportunity to reorganize how we deliver services now. The NHI allows, for instance, for the inclusion of outreach services to address health literacy. It allows for the contracting in of private GPs, pharmacies, and the like to make health more responsive to where people are. And I think doing these things more effectively actually reduces costs over the long run. And also when you see what the president was talking about turning South Africa into a construction site, I think it also makes health accessible for working populations. And I think I agree with the Premier of Gauteng, who says that one of the easiest ways to reduce the cost of living in South Africa is to improve publicly funded services so that we can reduce the costs of employment for people either in the informal market or in low-paying jobs.
I mean, just as the Rural Health Advocacy Project, talk to us about the collaborations that you have with local healthcare providers, community organizations, and some government agencies in order to advocate for policies and resources that are needed in order to support a holistic and integrated approach to rural healthcare delivery.
Look, as we're primarily a policy advocacy unit that works in coalitions with healthcare providers, civil society organizations, for the development of responsive health policy, right? So I think some of the things that we've worked on over the last couple of years is improving how rural provinces are funded, right, by changes to the provincial equitable share. And I think as of this year, we've had increases in funding to rural provinces. We also work in what we call the health a Rural Health Alliance, which is an alliance of rural healthcare workers, which seeks to advocate for better conditions for rural health workers, as well as to have rural district systems to be better funded and resourced. We also work more broadly with civil society organizations such as the Treatment Action Campaign, TB Proof, TB HIV Care, and others in strengthening the participation of civil society organizations at all levels of the health system, at district, provincial, and at national level. And we feel that by actively engaging and being part of developing solutions, we can create the kind of health system that is better responsive to the needs of the majority of the population.
And speaking of a health system that is better responsive, I mean, earlier on you spoke that a lot of our problems sit with primary health, and we're seeing that a lot of public hospitals are still sitting with stockouts of very crucial medications, especially in ARVs as well as with TB. How do we find ourselves still in such situations in 2024, and what do you think still needs to be done in order for us to bridge such gaps?
Look, I think the main investments that we need to make, and that's something that the President also mentioned, is really just improving our information systems. Right? I think there's a lot of waste and inefficiency in the system at the moment, because we need better improvements in terms of facility-led governance, better health management information systems so that we can better anticipate and predict demand, and also just better management of our financing. I'm not sure about ARV stockouts or stockouts in TB medication, because I think these are generally quite well funded. But we do have challenges with sexual and reproductive health medications, including barrier methods like condoms, access to family planning medications that people choose, and a lot of that is within the RHAP surveys conducted by our partners. But I think the key to really improving our investments is better information. And we need to strengthen those health management information systems at the district level and at the provincial level. I think since 2012, we've been struggling as a health system through consistent underfunding. Funding for healthcare has only increased by less than inflation each year for the last 10 years. And over time, all of those things start chipping away at the capability and capacity of the system to respond effectively. So I think the first investment that we do need to make is in having better information so that we can understand what the money is being spent on, where are the areas of loss, and how can we improve the efficient use of that money. Secondly, I think we really need to start looking at where people access health, and that's why health literacy is such an important thing. For instance, in 8 of the 9 provinces, 75% of cases in district hospital outpatients department are without a referral. And what this generally means is possibly that people are accessing primary healthcare level services at district hospitals because they feel that primary healthcare clinics are no longer responsive to their needs. So I think by introducing different service delivery models at the local level, including having clinical associates maybe inside clinics, contracting in private GP, expanding the scope of community pharmacies, we can actually get people to access healthcare services closer to where they are, unblock our hospitals to make sure that they start doing the things that they funded for. And really through better health information system, we can improve governance and accountability. In South Africa, we are gifted with a very comprehensive health system, but if we continue organizing it in the way that it currently is, even this is at risk, because healthcare needs are unlimited and the resources to respond to them are limited. So we have to make sure that the investments that we do make as a country are fully utilized and benefit the overall health and well-being of the population as a whole.
Most certainly, Russel. Thank you so much for your time this morning. A very sensitive issue, especially when it comes to healthcare services within the rural areas that are often forgotten, especially when it comes to the supply of some of those services. So we surely do hope that the Advocacy Project will be able to assist in the policies that are implemented in order for such services to reach the people in such areas. That was Director at Rural Health Advocacy Project, Russel Rensburg. Thank you so much for your time.